Welcome to this introductory video on Clinical Decision Support Systems or CDSS. Imagine a pilot flying a modern aircraft. While they possess immense skills and experience, they are also supported by a sophisticated co pilot in the form of a digital system that monitors flight data, provides real time alerts, and presents checklists at critical moments. This digital co pilot does not replace the pilot in charge, but it enhances the pilot's awareness and judgment, making the entire process safer and more efficient. Similarly, in modern medicine, healthcare professionals are increasingly working with a digital partner in the form of a CDSS. In an era where sheer volume of medical knowledge and patient data exceeds the capacity of any single human mind to be managed effectively, this partnership is becoming less of a luxury and more of a necessity. A CDSS is a digital tool that analyzes data from electronic health records, clinical guidelines, and medical knowledge bases to support healthcare professionals in making safer, faster, and more accurate decisions. It does not replace the healthcare professional, it enhances human reasoning by delivering relevant information at the right time. The effectiveness of any CDSS is guided by a well known framework called the Five Rights, which ensures that the support provided is useful and relevant and is seamlessly integrated into the care process. The right information. This involves providing evidence based guidance that responds to specific clinical needs. The right people, ensuring that information depending on the needs reaches members of the entire care team, including doctors, nurses, pharmacists, and patients. The right format, delivering information in a way that complements workflow and is adjusted to the type of decision being made, for example, through best practice alerts, visual dashboards, customized order sets, or documentation templates. The right channel, presenting information on the appropriate device or platform, such as an electronic health record, mobile device, or patient portal. The right time, making sure support is available at the exact moment a decision is being made within the clinical workflow. Decision support systems can be designed for two different audiences: healthcare professionals and patients. Clinical facing DSS tools work inside the clinical workflow. They help doctors and nurses make informed decisions by offering diagnostic and management support. On the other hand, patient facing DSS empower individuals to take an active role in their own health. Examples include mobile apps that track fitness data, vital signs, biometrics, medication, and treatment adherence, as well as symptom checking tools that direct people towards appropriate care. Together, these technologies help patients to stay informed, recognize early warning signs, and participate meaningfully in managing their health. CDSS is vast, including diagnostic alarm systems, disease management, prescription, drug control, and much more. They can manifest as computerized alerts and reminders, guidelines, order sets, patient data reports, documentation templates, and clinical workflow tools. Some of them can be integrated in the electronic health record system or can run independently. Alerts and reminders are among the most common and impactful functions of CDSS, acting as a digital safety net to prevent errors and ensure timely care. This includes medication safety, as CDSS can automatically flag potential medication related issues. That includes recognizing deterioration. Systems can monitor a patient's vital signs and lab results in real time. And lastly, it includes preventive care. A CDSS can issue reminders when a patient is due for routine preventive care, such as vaccinations. CDSS provides structured, evidence based guidance directly to healthcare professionals in a form of order sets or clinical guidelines, so they don't have to leave the EHR to look up best practices. Order set is a predefined group of orders for a specific condition or procedure. For example, the healthcare professional can select an order set that presents a complete list of evidence based interventions, ensuring that no critical steps are forgotten. Secondly, these tools also provide direct access to relevant medical literature and clinical guidelines. A healthcare professional might see an information bottom next to a diagnosis or medication in the EHR. Clicking it provides up to date reference information without requiring the healthcare professional to search an external website. CDSS that assist healthcare professionals in the complex task of diagnosis are known as Diagnostic Decision Support Systems or DDSS. By analyzing a patient's symptoms, medical history, and test results, the system can suggest a list of possible diagnoses and helps healthcare professionals consider a broader range of possibilities and can reduce the risk of misdiagnosis or errors. As artificial intelligence and machine learning become more sophisticated, the ability of these systems to analyze subtle patterns in data is significantly improving diagnostic accuracy and helping healthcare professionals consider possibilities that might have otherwise missed. By integrating data driven insights into the point of care, CDSS offers transformative benefits to patients, providers, and the healthcare system as a whole. Firstly, it includes improved patient safety and quality of care. By preventing adverse drug events and ensuring adherence to evidence based guidelines, CDSS directly reduces the risk of medical errors and ensure patients receive high quality care. Secondly, this includes increased efficiency and cost savings. CDSS streamline clinical workflows by automating routine tasks such as calculating dosages, reducing unnecessary or duplicate tests, and suggesting more cost effective medication alternatives. By avoiding unnecessary procedures and reducing complications from errors, this system leads to significant cost savings. And lastly, this includes enhanced clinical decision making. CDSS help healthcare professionals process vast amounts of patient data, reducing cognitive overload and supporting them with tailored, evidence based insights when and where they are needed most. CDSS technology is evolving rapidly. It has progressed from simple pre programmed rules and probability based systems to sophisticated ones powered by artificial intelligence technologies. AI integration enables the use of natural language processing to extract valuable insight from unstructured clinical notes, the use of advanced machine learning algorithms to identify patterns and correlations in vast datasets that would go unnoticed by humans, use of predictive analytics to anticipate potential complications or disease progression before they occur, use of personalized medicine by integrating genomics and lifestyle data to tailor treatments. Despite the clear benefits, the widespread adoption of CDSS faced several significant hurdles that require careful consideration. Firstly, when clinicians are presented with an overwhelming number of alerts, they can suffer from alert fatigue. This causes them to begin distrusting, disagreeing, or ignoring all alerts, including critically important ones. Second is the integration problem and workflow disruption. A key barrier to CDSS adoption is poor integration with EHR. A system that is not seamlessly embedded in the clinical workflow can frustrate users by requiring manual data entry, interrupting the natural flow of patient care, and forcing healthcare professionals to use other applications. One of the key risks of AI in healthcare is the gradual loss of professional expertise through over reliance on automated systems. This risk doesn't stop at technical or procedural skills. It also affects fundamental cognitive skills, such as clinical reasoning. Research shows that when AI is used as a replacement for independent thinking or cognitive offloading, this can lead to three forms of skill loss: de-skilling, loss of previously acquired skills; never skilling, failure to develop essential competencies; and mis-skilling, where biased or incorrect AI outputs are absorbed into a clinician's own thinking. Clinical decision support systems are powerful tools, but their recommendations are only as reliable as underlying data, design, and assumptions. It is essential to understand CDSS specific biases to ensure the systems support rather than distort clinical judgment and equitable patient care. Automation bias is the tendency to overtrust the recommendations of the automated system and thus check them less critically, even when they contradict other information. The opposite of automation bias is algorithm aversion, the tendency to distrust or reject algorithmic advice and favor human judgment instead, often due to the human factor of healthcare professionals' lack of acceptance and mistrust. Magical thinking is the unconscious tendency to attribute human qualities to an AI system. Because of AI's confident answers, we may treat them as objective truths rather than sophisticated statistical predictors. This can lower our critical vigilance. Clinical decision support systems are not about replacing a clinician's knowledge or judgment, but to augment it. CDSS can be understood as the part of the human in the loop process. The system can structure and analyze data, but it is the clinician who integrates this information with clinical context, discusses it with the patient, and takes responsibility for the final decision. CDSS is a powerful partner that helps clinicians make safer, more efficient, and better informed decisions. In an ever more complex medical landscape, this digital copilot is becoming critical to navigating the future of patient care. Thank you for watching this video. In the next videos, we will take a closer look at how specific DSS representatives are used by healthcare professionals in the differential diagnosis process.